the folks you're looking at up here on the stage, you know, when we got together and decided we were going to do this, I guess it was at the FMEC about a year ago or so. One of the goals was to obviously bring together a group and do some education about different models in the DPC area and arena. But the other goal for all of us is that the things that bring us together, the common needs and resources that we need, we all need common advocacy on a national level. You heard from Jay Keish yesterday about the need for really lobbyists to change national law to make it favorable for our type practice. And then you also heard from other folks that said we need a sense of community. I think we've established a pretty good direct primary care community at this meeting. But there's also other needs we have: resources, tools, you know, vendors, all kinds of things that we share and that we can share with each other, best practices and that type of thing, that really allow us all to bring each other up. So although we do have our unique identities and differences, we really do have a lot of common goals and needs. And so one of our hopes is that after today, you know, we all come in as individuals, and we leave as a group of doctors who really want to take back patient care and really make it about the physician-patient relationship.
It's fun to see the pipeline assured by medical students and residents and other people with their kind of enthusiasm and insight from North Carolina, where my son works, to Hershey, Pennsylvania, where I learned about chocolate as a family practice resident. Exciting to see those young people and to see the uniqueness of each of us dialogue, so we sort of start to become a tribe with a culture. And I would hope that we can find a way to anchor that culture in the traditions of DPC as we have it now, with the enthusiasm, the excitement, the citizen-like pride, as we are maybe possibly shredded by the numerati who have to get the data to prove that our culture is worthy. So that's my thing. It's great to see the founding people and to hear about the struggles they went through. I'm happy that they took care of that. It's so nice, but I love the tribe, and I'm worried about the culture as we move ahead, so we can have and retain a culture and the uniqueness at the same time.
Thoughts. One thing I'll share with you, Jay Fabi from Coordinated Care said to me afterward yesterday, you know, you should stop even calling this a movement. This just is. I said, wow. Okay. We still are kind of in the mode of feeling like a movement, but I think if you thinking about his point, I wanted to just throw that out to everybody as we think about what we're doing. And you know, his comment was, you know, he and a lot of other folks out there who are looking to providers for new ideas are looking for us to step up to the plate and just own it. So I'll throw that out as something we should really think about. And you know, movement suggests that we're a revolution forming up and all that kind of thing, which is great. It's very energizing. But we also, as I've said in a couple of my opportunities to speak, we have a fantastic opportunity right now. This is a remarkable point in history. And as I semi-jokingly say to colleagues, if primary care providers of all stripes can't step up right now and own the healthcare system and change it on behalf of our patients and ourselves, we should just go home. Because there's never been an opportunity like this. I mean, if you look at the history of transformational changes in healthcare systems in other countries, there was a confluence of historical forces that allowed something to happen. And if you look at what's happening in this country, we have all of this. We have our economy failed on us. It was exposed how fragile it is and how badly healthcare is, how much healthcare is contributing to that fragility, and it's worsening. And I think this is the first time, certainly in my lifetime, and I think for even longer, that people realize that there's something, the general public knows there's something wrong with the healthcare system, and we're constantly talking about it. Look at how much it's in the news, constantly. Another thing that's changed, when we first started Q-Liance, I had to explain what primary care was. And now, people kind of get it. So that's 6 years later that I don't have to explain primary care. I don't even have to explain direct primary care at this point. They all kind of know what that is too. They want to talk about the nuts and bolts of how to make it work. So that's a tremendous sea change. At the beginning, I was like, are we ever going to get past the discussion of like, what's primary care? Anyway, we're done with that one. We've had historic legislation pass that is just like any major change, has a lot of warts and cracks and all that kind of stuff, but it's created momentum for change, and it's started to make it not okay that, you know, a huge chunk of our population can be completely without access to the healthcare system. It's just not okay anymore. And Republicans and Democrats and everybody else, nobody is going to stand up and say certain people should not have health care. You just can't say that. And it's really part of the public debate. So, you know, we've exposed the quality deficiencies in the healthcare system, the service deficiencies. It's like, it's all been laid bare. You can't put that back away. You can't pretend that it's not there. So I really urge us, as we think about direct primary care, my passion for this is to change the healthcare system. And I know a lot of you share that passion. I urge us all to think about how can we be really strategic, own the healthcare system, step up to the plate. This is the moment we've been waiting for. We know primary care needs to be the foundation of the healthcare system. We have a lot of great ideas, a lot of motivation. We want to do the right thing for folks. Let's figure out a way to step up and do it. And if direct primary care is the mechanism that allows us to do that in the right way, fabulous. Let's figure out how to do it together.